back to the channel, y'all. This is Not a Real Doc TPT, and we're going to take on the topic today of what is really bad physical therapy. I thought we could expound a little bit more upon this topic after doing the last video that we did on what is bad physical therapy. So there were a few other examples that came to mind that we could benefit from discussing, at least touching base on. I don't think that these examples that I'm going to share are things that should be looked over. They certainly are examples of what would be considered bad physical therapy, even bordering on, or if not exactly crossing the line of what is ethical versus unethical behavior. So the first topic, or the not topic, but the first example that I will come up with happened in a clinic that I was working in. I no longer do, but at this particular clinic, there was a physical therapist who was going to be working with the patient, and the patient was going to be required to remove some clothing so that this PT could work with this particular patient. And absent-mindedly, that physical therapist, when the patient was disrobing so that they could cover themselves with the sheet that was left on the bed for them, actually did not leave the room for that to happen. It was My understanding is it was a completely kind of absent-minded situation, as I said, for that therapist. Apparently, they had turned their back on the patient and were actually working on notes, and I guess thought that was sufficient to give the patient enough privacy that they could disrobe and prepare themselves for the therapy treatment that was going to be done. No, that's not what should have happened. The physical therapist should have left the room, give the patient time to disrobe, then get comfortable with sheets. Usually, whenever I've had this happen with a patient, and it doesn't happen very often, but occasionally, if you are maybe dry needling in a particular area, or if you are doing certain myofascial release treatments and things like that, then you would you know, need to get to that patient's skin to be able to do that. Certainly doing like types of scar massage, etc. So there certainly are times that a physical therapist may require that. However, you always want to leave the room, give the patient privacy. That is just common sense. So that doesn't really go over the edge of unethical behaviors, but it just is absent-minded. It's not good physical therapy, and it needed to be addressed. So anytime that anything like that is happening, your physical therapist, as I say, should leave the room, give you plenty of time to just drape yourself in whatever sheet or robe that they have for you, and then after the treatment is done, then they should also likewise leave the room again and then allow you to get dressed, and then the sessions can continue outside in the gym or what have you. So that is one. That's my first example of a really bad behavior. At least it's not the worst, but we're gonna get there. I've got two more examples. They're kind of getting a little bit worse and worse. The second example, this actually comes from a person who was actually a personal training client of mine. Yes, I used to be a personal trainer, used to be in a lot better shape, and hopefully will be again in not too very long a period of time. But this personal training client that I was working with, this was actually a few years back when I was working on my doctorate of physical therapy as a student. So this patient or this client of mine at the time was having some back issues and some back pain. And so, me being a student at the time, I was very enthusiastic about the field of physical therapy, and wanted to help this client as much as I could. And so, I recommended her to go to a therapist that I knew of who had graduated from the program that I was in, and was practicing in the area where we were training at the gym. So I recommended, I'd had her go there, and she went there a few times and was having a good experience with this particular therapist. But then she came in for a session with me one morning, and I asked her, "Hey, how's that physical therapy going?" And she kind of paused and then kind of gave me a not real happy look, and just was kind of said that she probably was not going to be going back to him. And I was like, oh goodness, what has happened? Because at first it seemed like things had been going well and that she'd been progressing. So it was curious. I was curious as to why all of a sudden now she has decided that she wasn't going to continue working with this particular therapist. And she said that what had happened was at her last treatment, she was receiving some manual therapy and was apparently lying face down on the physical therapy bed there for this therapist to work with her. And without her, I still can't believe that this happened. It still is. Y'all are going to be quite shocked by this, but without this therapist asking her if he could do this, if he without um, just saying anything beyond doing the treatment that he was doing, he apparently pulled her shirt up and then unfastened her bra and undid her bra. Now again, she was lying on the bed, so nothing. There was no exposure that happened or anything like that. But it was. She said that it was just the fact that he would do that and go that far without actually asking her permission, without actually saying what he was going to be doing before he did it. She said she was really shocked by that. And I was really floored by that. I couldn't believe that this particular therapist would do that. It certainly, and again, she nothing untoward happened. Nothing, bad happened from that. There was no suggestive statements or anything like that went on. So it didn't go any farther. And again, this is kind of I believe it's more of an absent-minded type of situation of the therapist who is not understanding the boundaries and the boundaries on patient privacy, on patient respect. You would never do that. There's zero reason that I can think of as to why a physical therapist would need to do um, that. If I was working on a patient's back and their bra needed to be, and it was a female, and they needed to undo a bra, I I can't imagine why someone would not just say, hey, I'm going to need to work on this area. I'm going to leave the room. If you could unfasten your bra, if you're comfortable, that is, for doing this, then I'm going to leave the room. You unfasten the bra. Go ahead and lie back down on your table. I'll come back in, do the treatment, and then I'll leave, and then you can get dressed after that. Why that didn't happen, I'm not sure, but the patient, or my client, she wound up stopping physical therapy with this particular therapist. Did not go back to him. I actually wound up talking to one of my professors about this situation because he had this was one of his former students, and so what he said is that he would call the physical therapist and tell him about the situation and tell him, hey, look, you got to be thinking a little clearer in what you're doing. But that is another example of bad behavior, and that's it's you never. It's bad physical therapy. Your therapist should be much more attentive to that. They should be much more attuned to the situation, what it is that they're doing with you, understanding the boundaries and the respect that is necessary for that patient. And yeah, that's so I thought that was a good example of what would be considered, again, so a little bit worse physical therapy than the previous answer, or not answer, but the previous example I gave. And now the third example here, and this is going to be our final example, and you'll want to tune in and listen to this because it's really hard to believe that this actually happened. But I did not know and was not a part of anything related to this. How I actually heard this story and this happening was from our Doctor of Physical Therapy program. We have in our at the end of our first year, it's a 4-year program, and the end of our first year, in the summer of our first year, we were taken a class on ethics and ethical behavior in physical therapy, and this particular example came out during that class from our professor who was teaching that. It is one of the most egregious examples of physical therapy that I've ever heard of. But this was in the state where I practice here in South Carolina. Is actually down by the coast, and apparently, what this physical therapist did is and there are no names that are going to be revealed or anything like that regarding this situation. It's not necessary. But this particular physical therapist thought that it would be okay and appropriate physical therapy treatment for him to actually have, shall we say, uh, non-marital relations, if you get what I'm saying, with his patient. And actually, it was more than one patient, if I recall the story correctly. And not only that, he went so far as to actually bill these patients insurance for the time that they were actually spending in his clinic. So you you have a physical therapist who thought that it was appropriate, ethical, and ethical behavior, and that it was what his license intended for him to actually um, have sex with his patients. Um, I that's bad physical therapist or bad physical therapy. That's really bad physical therapy. No, that's certainly not appropriate in any. Certainly not in the state of South Carolina. Would hazard a guess that it is nowhere close to being appropriate in any of the states in the United States of America. Um, what in the world this particular individual thought that he was getting away with, how he thought that that was acceptable on any to any stretch of the imagination. It certainly is unethical behavior. It's the height of unethical behavior. Now, there was nothing in this story about this happening with this particular patient, or not. Well, it was with the patient and then the therapist as well. There, apparently, it was not like an abusive situation or anything like that. Apparently, the patient was all on board for this as well, but that is one of the most egregious examples of physical therapy care. You certainly are not doing any good for that patient, at least not for what they came to see you for. And it is, yeah, completely egregious. And it is a good what happened with this particular individual. He, of course, lost his license. I would assume that he got sued for insurance fraud and whatever else from the actual insurance companies that he was trying to defraud by doing that particular type of therapy. But no, in no plan of care and no practice, and no state practice acts for any physical therapy licenses or licensing organizations is it appropriate for your therapist, your physical therapist, to actually do that. It is, and it's. I don't know if there was a mental illness thing or what that was going along. You would think that was probably the case, but anyway, that's another, and that's probably the worst example of really bad physical therapy that I've ever heard of. And so I wanted to those three topics, or three, not topics, three examples came to mind when I was going through the bad physical therapy. Which, if you haven't checked that out, check out the previous video. Because that's where we talked about 10, or actually there were 12 examples of what's considered bad physical therapy. So I wanted to add this to that list, but these particular examples kind of separated themselves as being a little bit more unique. A couple of those are more absent-minded, and certainly the last example there is just completely egregious, and it is a complete example of what is considered really bad physical therapy. It is, and so if you are experiencing any of those examples in any of the clinics that you're working in, or that you're working in with physical therapists, I would highly recommend that you seek a different physical therapist. And so I hope that is a little educational for you on what is would be considered really bad physical therapy, and I hope that you do not experience anything um, close to any of those poor examples of physical therapy care and the care that you're receiving. All right, y'all have a good one. Bye.